Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of the coronavirus. Dr. Schwartz, last week we began vaccinations of our staff and residents. Where do we stand at this point? And moving forward, what is the schedule of vaccinations for Masonicare?
Well, Sandy, it's hard to believe that this is December 30th and it's like our last presentation of the year. And it's been quite a year. We've had quite a month of December, I've got to say. And as you probably know, there are two vaccines now that are approved for vaccination against COVID-19, Pfizer and Moderna. And you probably also know, last week, we had two clinics for vaccinations, both December 21st and December 22nd. And I think they went very well. I'm just going to read some data that I have because I can't memorize everything at this stage of my life anymore. But at any rate, so at MHC, there were like 243 employees and 172 residents that received their first dose of the COVID vaccine. And this was along with 48 residents at the Wright Building. And for residential services, there were 108 employees that participated in the COVID vaccine clinic at Asher Village, and this was along with 51 assisted living residents. So this is really a nice turnout. And we were working with our care partner, CVS, and there's two more clinics scheduled for January 11th and January 12th. And during this time, employees that haven't yet gotten their first vaccine will have a chance to get this vaccine. They'll sign up either on the 11th or 12th. And those of us that have gotten a vaccine already will get our second vaccine. And things are still being finalized for other parts of the continuum. And I think the main thing for everybody to realize is that we follow CDC guidelines and how we do this process. I think a couple of things I just wanted to focus on again, and I've mentioned this in other presentations that we've done, are two important task force that we have, the coronavirus task force and the COVID-19 vaccine distribution task force. And as I also mentioned, there are, it's made up of leaders from across the continuum, and we all put our heads together. We meet every day. And the idea behind all of this is to streamline the process, make things as efficient as possible, staying on top of CDC guidelines, and staying in touch closely with CVS and kind of going over any issues that may have happened that we could improve upon over the first session of clinic dates. But I think the most important thing that comes out of these committees, aside from working together as a team, is that we stress communication. And things change constantly. Communication is very important. We try to put out information for staff on a regular basis that kind of lets you know when we know something. We try to update everybody so that we're all on the same page. So by now I've been doing this a while, JP and I, and I try to think of an inspirational message after each talk that I do that kind of focus on something that I want to say or focus on. And I have this quote actually from Theodore Roosevelt this week. And he said, "Keep your eyes on the stars and your feet on the ground." So you might ask, why did I come up with that quote in the middle of a pandemic? Well, so let's take the first part, keep your eyes on the stars. It's natural for people to want to reach for the stars, go as high as you can, be free, dream, whatever it be. And that's very important, but you also have to look at the reality and keep your feet on the ground. So even though we're making a lot of progress, a lot of people are being vaccinated and we're moving forward, we still have to keep our feet on the ground and realize that it's still going to be some time before we're safe and everybody gets immunized. And really by keeping our feet on the ground, I mean wearing a mask, social distancing, washing your hands, avoiding large crowds, and as hard as it is to say around this time of year, avoiding travel whenever possible. But if we do this and we keep working together, a year from now, I think we're going to continue to be in better and better shape. So from me to everybody, I just like to say, goodbye to 2020. I don't think anybody regrets seeing 2020 pass. And, certainly I thank everybody for all working together and all the hard work everybody's done. And I just want to wish everybody, their families, happiness, health, and peace in the new year. Thank you.
Thank you so much, Dr. Schwartz. Absolutely. And JP, to go right along with his perfect quote, as always, the holidays coming to a close and this new year is beginning, but we are certainly not out of the woods yet.
Andy, not at all. And Dr. Schwartz hit it on the head. This is 2020 is a year to remember and forget all at the same time for many of us. And with that being said, the end of December has been, I think, a whirlwind for all of us. In Connecticut, from last week, I'm say Sunday night, there were 36,276 vaccines given. Of that, 7,283 were given to nursing home staff and residents. We were, as Dr. Schwartz said, 620 of those were here at the healthcare center and at Pond Ridge. So we've seen some good movement on the vaccine front. And I'm happy to say that we have our dates for the vaccine beginning of January for the Wallingford campus. But we just heard last night that some of our assisted livings throughout the state that we are part of are seeing dates in the early part of January for their vaccine. So that's absolutely fantastic. I'm also happy to say today that our home care staff are giving vaccinations to the Wallingford Fire and Police Department today, which is another step in Masonicare being part of vaccinating those out in the community, which is fantastic. But even with all these vaccines, we still have a long way to go. And though the holidays bring joy and some anxiety with the vaccine, we still need to continue to do our due diligence by wearing our masks, social distancing, not being in large groups, restricting as much travel as possible is still really the number one priority I think everybody should have. But with that being said, Sandy, I think we also should be looking at the joy and the hope that is coming as we continue to get this vaccine out. Because as Dr. Schwartz said, a year from now, hopefully there'll be some normalcy in what we do. And I'm excited to see that light at the end of the tunnel. Last week was a week that was a start of that hope. Was a start of us getting to where I think we can get to that normalcy, and the vaccine is part of it. But we still need to do, as I said before, masks, social distance, avoid a lot of travel, and large groups are still things we're going to need to continue to do in the foreseeable future.
Absolutely. Thank you, JP. And thank you both so much for sharing your time and all of this important information with us today. And thank you for watching at home. We wish you a very happy and healthy new year. Until we see you again, stay well, stay safe.